am Paris Kagotho. I am a medical doctor. I've been one for the last 16 years. Worked in both outpatient, inpatient, within Nairobi, private, outside Nairobi. But I also do a lot of telehealth, telemedicine. That's something that is new in the last couple of years. I am a quality specialist as well as a patient safety expert.
My name is Pastor Simon Mohuko Maina, and I love Jesus. I am the pastor here together with my wife. I'm also a caregiver. Thank you. Amen.
My name is Joy Mohuko, and I'm a medical doctor, and I'm a mshirika, and a caregiver.
So I'm Farida Kagure. I'm a pain and palliative nurse specialist and also a counseling psychologist. I consult with Equity Afya, but if you come to one of the biggest institutions in Kenya, you'll find me there wearing another hat. Thank you.
I am Mombi Njoroge. I'm a clinical psychologist, but also a specialist in integrated mental health promotion.
Thank you so much. What really is mental illness or mental disorder, as people may call it?
When we say that we avoid using the term illness. We nowadays prefer to call it a disorder. There's just order imeenda kidogo off. But when we talk about that, we are talking about a condition that has already been diagnosed, and usually it has moved from the mind, the thinking part, to the physical brain. The thing we say is between our 2 ears. Then we say at that point, you are having a disorder. Many people call it illness. It could be looked at as a disease. But there are so many. We have a big Bible for mental health. We call it the DSM. There are so many. Most of us know just the people we say big papers here and that. There are very many disorders.
So when you talk about disorder and health, what is the big difference between illness and a disorder?
Illness and a disorder are the same thing, but illness is stigmatized. The whole idea is when you talk about illness, there's a lot of stigmatization. And therefore, that's why we talk about a disorder. It sounds a little bit milder. There is something we call a classification of anxiety disorders. Anxiety, for some people, it's fear. For some people, they get panic attacks. And like Gishuhi was saying, Paul.
And therefore, it's a disorder. It's really a problem. There are people who even struggle. They feel like they are going to have a heart attack, or you just panic and there is no reason to panic. So it's actually something that needs to be taken care of. And at some degrees, we actually do give medication, which we call anxiolytics, anti-anxiety drugs. Maybe one of the things I should say is that mental health disorders are classified. We have 7 floors. If you were to look at it in terms of magnitude, we range from, now the bottom one we call borderline. You're near the cliff, almost falling down into a major place. So that's, we have what we call borderline. We have a stage we call minimal. We have a stage we call mild. Then we have moderate, we have marked, we have severe, and we have extreme. So just because yours is borderline does not say you don't have a disorder. It's just very minimal. And so we need to differentiate that.
Dr. Farida, you are a psychologist. I want you to look at this issue of stigma because she mentioned something to do with stigmatization. When we talk about illness, it's stigmatized. How would you bring this issue out so that people may understand the issue of stigmatization as associated with a mental disorder?
The definition of stigmatization or stigma is looking at a person in a way that you're looking at the illness instead of seeing the person, you see? And when you talk about stigma, in connection with mental illness, it's a real thing. It's something that we might not be, aware of, but like Dr. Mumbi said, when somebody walks in and they are smelling, they've not bathed because they have that disorder that is making them neglect their, activities of daily living. And the patient, I'm talking about the patient because I'm used to patients, sorry. And the person walks into church and they're smelling and you go like, you don't want to sit next to them, you're showing like, huyu ananuka, unatoka hapa unaenda kule mwisho. That is stigmatization. So stigmatization is real and it is with us. And why we get into stigmatizing others with mental illness, it's because first, we do not understand what mental disorders are all about. So bottom line is lack of understanding of what mental health is all about. And like she said, we are all potential, mental disorder holders. Let me put it that way. You can have a mental illness anytime. So the fact that you do not understand what mental disorders are and how they can present can make you stigmatize the other person. Call them, merogwa, they are sinners, they are all those labels that we give them. It's out of lack of understanding of mental health.
First of all, by the time we get to stigmatization, it is because we are looking at the person that has the disorder as if they are abnormal. So in our definition of what is abnormal is what you consider that has deviated from what as a society we consider normal. So if I seeing a patient coming in, and maybe the way they are dressed, the way they are talking, sometimes it's even the pressure of speech, sometimes it is even how they are, it's something small, like their eyes are shifting up and down, and you see like it does not look normal to you, then you first of all classify this person as abnormal. Now, having classified this person, the next step usually is, do I want to be associated with this person? Which is where now many of us, having looked at the abnormality of mental disorder, we find that it is too strong an issue to hang around with, then we shun the person. So now, having shunned the person now, of course, it brings in now the whole stigmatization discussion, yeah? Now, in the first place, we need to realize that just as Dr. Mumbi had said earlier on, how many of us have ever in their life had a headache? Anyone? Who has never had a headache? Maybe that's the question I should ask. Who has never ever had a headache? Yeah? You will come to me in the hospital, and when you come to me in the hospital and tell me I have a headache, one of the questions I'll ask is, where? Where? I know you're thinking it's in the head, but where in the head? Is it frontal? Is it side? Is it back? What's the character?
Maybe, Dr. Paris, this matter of stigmatization seems to be so wide, and it's like people may not even understand when they are causing the stigma. Maybe if we could hear from a caregiver like Bishop, have you ever suffered the stigmatization in your course of caregiving?
I have suffered stigmatization for quite a while, a long time. And there are people who normally think I could be the problem. There's something which is not right. And they'll meet you and ask you, what are you doing to your wife? So I think, to me, one of the challenges that people don't know about mental illness. Sometimes it does not have necessary to have a cause. Might be something genetic or hormonal imbalances. So I think the greatest challenge is that people don't know what mental illness disorder means. So they are talking from the point of being ignorant. And I like what Jesus said, you will know the truth. Once you know the truth will set you free. So to me, basically, people are speaking from a point of what people think or some assumption they already have in their mind. They don't have the truth about the matter.